Okey doke.
Gonna print it. Okay, so you want me to begin by calling the meeting to order?
Yes, that works.
Very well. Hello, everybody. I saw you briefly there when I was there with you in video. Good to be together again for the emergency meeting. The meeting is now called to order, and Jamie Hastings will call the roll.
Dr. Burkaris, Molly Munger,
Here,
Myra Alvarez,
Here.
Elsa Jimenez,
Here.
Monica Fitzgerald,
Here.
Shayna Hazen,
Here.
Jackie Majors,
Here.
Chris Perry.
Here.
Thank you.
Great.
okay, all right. As you know, today we're gathering to discuss the possible continuation of our investments in distributing emergency supplies to childcare providers who are prioritizing services for children of essential workers. We've been doing this for a year, as you all know, through our ally and partner supply bank. And the question is whether we're going to continue doing that. If we do decide to continue to do it, we will secure the contract to procure and deliver the supplies. And that takes time, and the need is immediate, which is why we call this emergency meeting. Camille, could I ask you to give us an overview of the virtual meeting? How it's
Yes.
going to go?
Sure, thanks so much. So as we've heard before, the points around conducting this virtual meeting are first and foremost, if you're having any technical difficulty, commissioners or members of the public, please send an email to info@ccfc.ca.gov. Actually, commissioners, you should just tell us, but for the public, please send us an email. We have staff standing by who can immediately assist you. So, excuse me. Commissioners, you're great at this, but as you know, to eliminate the background noise, it's helpful if you would mute yourselves during presentations. Upon each agenda item, you'll be able to provide feedback and ask questions. You can either use the raise hand function in the Zoom or simply raise your hand, and we will be watching to make sure the chair knows you're wanting to speak. Jamie Hastings will help us with the meeting in making sure everyone is recognized who wants a turn to speak. She'll also be monitoring the chat during the public comment, and people will be called upon individually and then have an opportunity to speak. So with that, I think, I guess, I don't know if I'm sorry to say, but we're used to this. And so we've done it many times over. And so unless there are any technical questions, we'll go ahead and get started with the meeting. Any questions? Don't see any, Molly. I think we're good to go.
Okay, so this is the point where I ask all of you commissioners to tell us if you have any conflicts of interest, actual or potential. No. Whether you have any conflict of interest with this agenda item. And do I have any show of hands or anybody wants to say that they have a conflict on this issue? Okay, very well. Okay, now it's time for public comment. Members of the public may speak for up to 3 minutes on any non-agenda item or items not related to pending judicial, administrative, litigation, or personnel matters. No action by the State Commission may be taken on this public comment. If you wish to comment, use the raise hand function or the chat function that's available, or the chat function if raise hand is not available. Jamie will call on the public in the order in which they're signed up. Do we have any public comment?
Yes, we have a few. The first is Lonnie Schiff-Ross. She's connecting now.
Wonderful.
Good morning. My name is Lonnie Schiff-Ross. I'm the Executive Director of First 5 San Joaquin. I will just say, first of all, thank you for all the ongoing support so far. As one of the 2 remaining Executive Directors in First 5, I've been here for 20 plus years. I've never seen anything like what we're going through now. And I will say that this has been a phenomenal partnership with First 5 California and Supply Bank. It's also been a wonderful partnership with so many in our community, as we now have had 5 different sets of supplies. We've had partnerships with our local R&R, our resource and referral, our WICs, our community centers, a dining hall, and family shelters. We've had over almost 140,000 masks delivered in our community, almost 120,000 diapers, almost 1,500 books, and very hot in demand is our 240 infrared thermometers. So I want to first say thank you to all of you for the commitment you've made, for the endless hours you've spent discussing this. The communities are definitely, we are benefiting from it. And I would offer my full support for the ongoing investment. Thank you.
Thank you.
So thanks so much, Lonnie, for those comments. I just want to make sure people understand that comments about the agenda item around emergency supplies should happen during that time. This public comment is for things not listed on the agenda. So if you have something outside of the emergency supply item that you would like to address the commission on, now's the time to raise your hand. And if not, we'll go forward. Anybody?
Oh, just Nadine is ready to join.
Okay. And Molly, I think Dr. Burke Harris is joining us as well.
Wonderful.
Come on.
Right in time for the action items.
I think.
Well, I'm looking at my right.
Huh?
My right's been taken away.
Oh, okay. We have a little technical glitch in whose ability to get her on board. So, and I don't believe we have any other public comment. No other public comment. So there's been a mad dash. There she is. There we go.
I was staring through the glass. Thank you. I apologize for being a few minutes late.
The baton is now in your hand, Madam Chair.
Thank you.
We're right at the action item. We're about to start that one.
Wonderful. Let me get caught up here. I apologize. Or maybe Molly, if you want to take us through the action item, and then I can catch up.
Okay, sure. Catch your breath. There's just a little squib that I am to read. Protocol for action items includes staff presentations, questions from the State Commission, public comment, deliberation, and voting by the State Commission. There will be a 3-minute per person time limit during public comment. And now I think I can defer, or if the chair agrees, we'll defer to Camille to now present the item.
Dr. Burke Harris, what would you prefer?
Yes, please, if you can go ahead
Okay.
on the item,
Got
that would be wonderful.
Actually, this is the first item is for the commission to actually take an action to have an emergency meeting. So the Bagley-Keene Open Meeting Act defines the basis by which we may conduct an emergency meeting. And specifically, it states, in the case of an emergency situation involving matters upon which prompt action is necessary, due to the disruption or threatened disruption of public facilities. A state body may hold an emergency meeting without complying with the 10-day notice requirement of section 11125 or the 48-hour notice requirement of section 11125.4. The emergency meeting must at least meet one of these criteria. Number one, work stoppage or other activity that severely impairs public health or safety, or both. And two, crippling disaster that severely impairs public health or safety, or both. So in light of COVID-19 and supported by the governor's emergency proclamation, an emergency situation exists to conduct an emergency meeting. In order to move forward with the item on emergency supplies, we must vote first. You must vote first to hold an emergency meeting. We are recommending Commission approve conducting this emergency meeting based on the requirements for an emergency situation as defined by the Bagley-Keene Open Meetings Act. And now, Dr. Burke-Harris, I don't know if you want to ask for a motion. Oh,
Yeah.
there's a question.
I'm,
Sorry, Shayna, did you have a
No, I
question?
was prepared to make the motion. So I appreciated all the information sent in advance, and I'd like to make the motion to hold the emergency meeting.
Second.
Thank you, Commissioner Hayes, and for the motion. A second from Commissioner Alvarez. And I'm sorry, Camille, did you say there was a question, or do we need to pause? To allow
No,
the question?
I think Shayna was helping move us along. She was just raising her hand to make the motion, so.
Great. And so is there no public comment?
No public comment.
Okay, in that case, Jamie, can you do the roll call?
Yes. Myra Alvarez,
Aye.
Elsa Jimenez,
Aye.
Monica Fitzgerald,
Aye.
Shanna Hazen,
Aye.
Jackie Majors,
Aye.
Holly Munger,
Aye.
Dr. Burke Harris.
Aye. And so the vote is carried unanimously. And we will move forward to discuss the continued distribution of emergency supplies during the COVID-19 outbreak. Camille, do you want to go ahead?
Sure. Sure, thank you so much. And again, thank you, commissioners, for making time today to have this discussion. We have a presentation, and I'm excited to say Simon Marquez, who has been managing our supply, not only the contract, but working with counties and with supplybank.org, our vendor, is here today to make his first presentation to you. So we're excited to give Simon the opportunity to talk about this work. And with that, it's been a year. We started this actually last April. So with that, I'll turn it over to Simon. He can tell you a little bit about not only what, but why we're recommending that you continue this. So Simon, take it away.
Thank you, Camille. Can everyone hear me all right? Excellent. Thank you for commissioners for taking the time out of your busy schedules to meet today on this important topic. I am just going to quickly share my screen so that I can take you through some slides. And here we go. As I'm sure you're all aware, we are still living with the effects of the COVID-19 pandemic. Even after all of these months when we first met to discuss how to address this generational crisis. Before jumping into the heart of the request, though, I wanted to quickly share with our newer commissioners the history of our original investment that was initiated back in April. At the onset of the pandemic 1 year ago, Chris Perry reached out to First Five California and other state partners to discuss the viability and interest of an emergency supplies initiative. along with our partners at the First Five Association, supplybank.org, and several other organizations. First Five California conducted a needs assessment to quantify the needs of childcare providers remaining open for the children of essential personnel and the broader community. This work was completed ahead of other departments and provided valuable data for allied efforts at the local and state level. This assessment led to an initial $4 million investment by the Commission for emergency supplies to be distributed across all 58 counties. The Commission subsequently appropriated another $1 million in funding during the May 15th, 2020 Commission meeting. To create an equitable program, supplybank.org took the number of items requested for each product across the state and allocated that amount based on each county's birth rate. A baseline was added to ensure smaller counties had a meaningful amount of resources. Additionally, the Emergency Supplies Program spent 96.25% on cost of materials and shipping, and only 3.75% on administrative costs. The materials were also procured below market and leveraged with additional in-kind support through private donations, collectively adding an added benefit to counties and their partners. As requested, Supply Bank worked directly with each First Five County Commission and or their designated lead agency or agencies to develop a county-specific distribution, storage, and delivery plan. These county-led plans include a vast network of safety net actors that can collectively reach their respective communities. Because of the local autonomy and flexibility of First Five California's emergency supply program, county commissions were able to leverage existing resources to provide supplies to those most vulnerable and hard to reach populations. This allows our emergency supplies program to maximize its investment and target those traditionally underserved communities. Through the $5 million investment approved by the State Commission, supplybank.org distributed millions of units of the following emergency supplies throughout the state, as you can see here on the slide. This has been a great achievement and an example of the collaborative partnership between First Five, the First Five Association, state and local partners in order to get crucial supplies to children, families, and providers during the COVID-19 outbreak. Now, as you'll see here, you might have remembered from some of Camille's previous updates, there's been some media coverage throughout the state and various counties that we've shown in the past, and I just wanted to just briefly go through some of these just so you can see kind of the breadth of what was covered throughout the last year. I'm not going to stick on any one particular, but I just wanted to kind of show what was covered through our program. So what's next? First Five California staff wanted to make sure that we weren't leaving our county partners holding the bag when it came to supply procurement and distribution over the next few months. As you know, the contract expired in February. The last large distribution of supplies went out in December. So while things are improving in relation to the pandemic, providers are still struggling to keep doors open and to provide childcare services to children of essential workers and those at risk, high-need populations that are so often left behind during a crisis. While scarcity of supplies was prevalent during the initial stages of the pandemic, cost and access to supplies is still a current issue for programs at this juncture. It was important that we again worked with our county commission partners, engaging the interest and need of another investment until vaccinations were more widely available. Coronavirus cases continue to drop, and that providers were able to safely open back up and deliver those valuable services to children and families. Through a survey disseminated to 58 county commissions and their local partners, we were able to get 57 responses that provided us with a clear needs assessment for each of our county partners. The following slides are a few of the highlights from this survey. As you can see, an overwhelming number of counties still have need for emergency supplies. A considerable number have exhausted local resources, and a majority of county commissions have agreed to continue to take the lead in distributing these supplies to children and families in their community. Of the county commissions not running the program as the lead, their allied agencies were designated early on in this crisis, and this structure has worked well over the last year. Here you'll see the average priority level for the highest rated emergency supplies based on statewide survey results. Not surprisingly, disinfectants and PPE rose to the top. Similarly, here is the results of the 10 largest counties, which make up about 70.8% of all births in the state circa 2019. Here you can see the comparison of data points between the statewide versus the 10 largest county results. For the most part, there is a correlation between the two in terms of the items that are the highest prioritized. So why another investment? While First Five California has not historically funded direct services in this way, staff believe this is an opportunity to support children and families during a once-in-a-lifetime pandemic and in a multitude of important ways. Through our survey results with local county commissions and their partners, counties have overwhelmingly, almost unanimously, requested this assistance, and most have no alternative funding source for these resources necessary for the health, safety, and comfort of their communities during the pandemic. There is an opportunity to be reimbursed by FEMA and reinvest in this emergency supplies program at little or no cost to the State Commission. As I'll clarify in the next slide, there is a better chance of getting reimbursed by FEMA with the new Biden administration coming on board. Other state agencies have targeted specific recipients for emergency supplies, for instance, Title 22 licensed programs, centers, and family child care homes. Whereas First Fives have the flexibility to also support the broader hard-to-reach communities like migrant families, family resource centers, family friend and neighbor care, and other community-based organizations. A contract with a supply bank would be administered at a minimal expense of 3.75% overhead costs. Conversely, some state-funded diaper banks and similar programs operate at 10% or upwards of 25% indirect. Local First Fives are uniquely situated throughout the state and in their local communities to provide emergency supplies to those underserved at-risk populations in a timely manner. There's an opportunity to work with CBOs and family resource centers to help communicate with hard-to-reach populations about how they can access vaccinations during a challenging rollout, especially when supply increases. This network is already being utilized to disperse other information on services and safety best practices regularly. And finally, just an opportunity to provide efficient and effective support to children and families, again, during this once-in-a-lifetime crisis. This critical investment will enhance county efforts already underway, produce PPE savings for providers in the community, provide stability to local planning, and ensure our stakeholders and community members have the resources they need for continued health, safety, and comfort as the vaccination effort grows in the coming months. So as I mentioned in the previous slide, positive development is underway as a potential external funding source for this investment has been identified. First Five California has been working with the Governor's Office of Emergency Services, Cal OES, and applying for federal disaster relief funds from FEMA. With the new Biden administration, changes have been made via this presidential memorandum to eligibility criteria that had been previously deemed ineligible with the prior administration, excuse me. The difference between prior till now is prior, they were focused solely on healthcare workers. Now that they have expanded that to schools, childcare, that sort of thing. So it's obviously expanded to make us now eligible. It's anticipated that activities and expenditures related to First Five California's previous contract with supplybank.org will be reimbursed at or near 100% of our initial investment of $5 million. This FEMA reimbursement could potentially cover the entirety of this current request that we've brought forth to you today. So to that end, staff recommends the commission approve up to $2 million to supply local communities with necessary supplies to continue addressing the COVID-19 pandemic through the summer of 2021. So just to provide some context to the level of this potential investment, here you'll see how far $2 million can get us in terms of an individual supply. Also, this table here shows how the investment affects the unallocated fund account balance for this fiscal year 2021. To clarify, however, these balances could look drastically different if First Five California is approved for FEMA reimbursement, thereby boosting the funds account net year-end balance by up to 45%. Thank you very much for your time. I'll open it up for comments from the commission and ask that Camille and Benito Delgado Olson from supplybank.org join me to help answer your questions that you may have.
Thank you very much, Simon. That was a very thoughtful and thorough presentation. And I think now we want to open it up for discussion. Are there any, do you mind, Simon, ending your screen share so that we can all
Absolutely. Yes,
see
absolutely.
each other?
Thank you.
Any questions or comments from the commission?
I believe Elsa has a question or comment, as does Shayna, as does Myra.
Thank you. So first a comment, thank you again for the great presentation. And I'm glad to see that, you know, all entities really rallied around providing necessary supplies needed to our children and families as we entered the pandemic, and glad to see that this request is coming forward again. My question is, how does State First Five distribute these materials? And do we provide all counties? Do counties submit a request? You know, how does that work? And then secondly, is staff recommending a specific expense? So for example, you showed like $2 million will give us X number of face coverings. Or are you really seeking just general direction to spend up to $2 million and then be able to meet the needs of each jurisdiction based on what supplies or materials they need?
Yeah, great question. And Benito can chime in as well. I will say we have done, along with the survey that we provided you, we also got a needs assessment of what they would like to receive by county for this upcoming investment if it is approved. So we feel like we have the data and we're ready to hit the ground running, including getting a contract in place if we indeed are approved to do so. So I feel like we've got a lot of ducks in a row, so to speak, in order to meet the very unique and specific needs of each county.
So Commissioner Jimenez, we are asking the commission to approve funding up to $2 million, not for specific items to be purchased, but using the information that we've gathered from counties as to what their needs are, working with them to make sure we're delivering the right things to folks in what they need. So did that answer your questions?
Yes, thank you both.
I think we have Myra and Shayna who had questions.
Thank you.
Thank you, Simon, for the information. It was super helpful and really important to know we're doing this work in partnership with counties up and down the state. So thank you for that. I have a question about the who received the supplies. Is it all childcare providers? Because do you have a slide that talks about that network, the collaboration with family resources and resource centers and WIC and homeless shelters? Do you have a breakdown of that to better understand where these supplies went out that could potentially inform, which ones reached families, which one reached areas, which counties had those types of collaborations, and maybe we can find out why. Do you have any of that data that could build on slide 3 a little bit more?
Not yet. However, that is a great question and something we've been thinking about as we potentially transition to something new. At the time, we weren't trying to burden localities with data collection per se, although we feel like with the relationships locally that we can go back after the fact and get some aggregate data about who the recipients were, who the various organizations were that received and then dispersed to their various constituencies. So we recognize also that, if there was a new program, a new investment, that I think that's something we would try to do then on the front end as well with a new investment, as well as getting prior information from the prior investment.
Okay. I'm sorry, go ahead, Camille.
No, just to say anecdotally, we've heard over time about who's receiving it, that essentially in the very beginning, as Simon said, the goal was, and I think Chris will remember, our goal at the very beginning was to get supplies to providers who were caring for essential workers. And that, as we started out, that really was. It evolved over time to include a wider range of entities, such as family resource centers and those types of programs that were more directly involved with families than through providers than the families. So Simon's right. In the very beginning, we were our goal was to get it out as quickly as we could with as little burden to the people who were doing that work as possible. But in talking with counties, I think we can go back and get that information. That doesn't help you, I realize right now, to make a decision. But I would say that families have been beneficiaries of this, of the supplies. And I'll just look to Benito, who has been most directly involved with counties as far as distribution. Benito, do you have anything else you could add?
Yeah, I think a little context. Good afternoon, everybody, and congratulations to the new chairperson and the new commissioner, since I don't believe we've met before. But yes, when we first created the program, the intent was to just get it out as quickly as possible, but also the reason why First Five, I think, was seen as such a tremendous asset at the onset of the pandemic was really because of the county networks that are in place. In the 0 to 5 space, First Five county commissions are really the institution of knowledge that know how to reach these populations and how to work with R&Rs. They're targeting childcare providers and so forth. So, to Commissioner Jimenez's previous question, we initially worked with Francine at their commission, and then Beth from her staff and Chris in partnering on the FEMA issue. In San Diego, as Commissioner Hazan may recall, we worked with Alethea and her team and their R&R and a whole host of CBOs. But what I will say, and perhaps might be echoed in public comment, is that the counties were extremely organized in how they did this. We anticipated having to provide much more support at the onset than was actually requested. And having participated in a number of the community distributions across the state, everyone has been registered if they're a CBO, a WIC, provider, etc. And the commissions have been collecting all of that. Most recently, it wasn't part of this investment, but we distributed 1,000 air filters and 2 extra backup filters for air purifiers at the Oakland Coliseum for childcare providers over the weekend. And those networks have been in place for more than the last year. What this program did was leverage the 20-year investment of First Five around the state. And so the collection, I think, from the 9 or 10 counties we talked to ahead of this meeting is that most of that information is memorialized. So it's something we can definitely work on, but also plan to do in the future.
Great. Thank you for that. And then my last question, sorry, is around, can you remind us, Simon, how the distribution happened as far as like, is it same across counties? Does it depend on the same formula? And the reason I ask that is that the governor recently made an incredible announcement about equity and having a more equitable allocation of vaccines based on the hardest hit communities. Given, you know, the limited resources that we have, is there opportunity to put an equity lens in the distribution of these resources to ensure those hardest hit communities by COVID have the opportunity to benefit disproportionately from this investment, particularly immigrant communities who do not have access to resources from the federal level, who were trying to fill gaps at the state level, but aren't able to, obviously, because the federal government should be able to do more. But really just thinking through, how can we replicate the equity approach that the governor has led with and that we all applaud with this distribution as well?
Yeah, I think there's definitely an opportunity to do that and maybe refocus or shift focus. I think what one of my previous slides said was we used the birth rate to provide a prorated formula with kind of a baseline so that it supports the obviously smaller counties to make it a little bit more equitable across the state. However, if there is a shift in thinking or strategy, we are definitely open to looking at that as we strategize about how we distribute individual supplies. I feel like we have the specific items, identified that counties want. So now it's just a matter of now, how do we focus on maybe shifting a little bit more to families or those hard to reach communities? And is there a different way in which we can create a formula that makes it equitable across the state? So I definitely willing to work with commissioners to kind of think through that and bounce some ideas off of. I don't think we have anything baked in at this point. Obviously, we had what we did before. And if that needs to be tweaked, then we are happy to do so.
Just as a friendly suggestion and add-on, something we've done with counties that have made their own investments into this program, we use data on community spread. And so that's or new transmissions of the virus, and that's been effective. Is a method before and might be something that could be taken into consideration here too, if it's what the commission would like to do.
I have a comment, question, or something just for consideration. I think that, we have communities and then we have neighborhoods. And what I have learned through some of the distribution here in LA County, not just from you all at Supply Bank, but with lots of the other entities and philanthropists that are coming to the table, is in most cases, the parents and the providers have to get to a location. And they have to get to a location with a vehicle so that they can pick the stuff up. And, many of the organizations that I work with, we were able to supplement funding to mail things and to deliver things. And so I would just ask us to consider that, because that could also create hardships and lack of equity within communities, right? So if your data says we need X amount of things in Mendocino, or we need X amount of things based on the birth rate here, my question is there also equity in the actual distribution within those neighborhoods? Because that was a challenge frontline that we saw, and I sat through in my community and in other areas at the drive-bys and the grab and goes. And really, it was the luxury of those people that were able to show up with vehicles. And many of them that staff had to help partner ride shares in a time of COVID where people don't want to do that. And many organizations thought innovatively and had the funding, the benefit of funding, to be able to supplement delivery, and whether that was staff going out in trucks and or mailing supplies. I would argue that that's probably an issue statewide, and maybe not our problem, but I think if we're actually interested in ensuring the saturation and the target to all communities and raising that lens of equity, it's something we should consider.
Absolutely. Thank you.
I would just suggest, so two things. One, in terms of the state's equity strategy that's driving our vaccine equity initiative, what we're using there is the Healthy Places Index and looking at the zip codes that are that are in the most under-resourced quartile of the Healthy Places Index, which is where we see that 25% of the population is experiencing almost 40% of COVID cases and deaths, and also has received just 16 or 17% of vaccine. And so I think that data is available from CDPH, and it seems like that would be maybe not too hard for us to overlay that, look at those zip codes, because I know that's fairly easy to access. And then the other suggestion, if we're thinking about how do we overcome some of the challenges in terms of distribution, I've been really impressed by our ability to work with corporate partners and the number of corporate partners who are willing to work with the state in distribution. And so that might be an opportunity there, whether it's working with a corporate partner like Amazon or UPS or something along those lines. That might be an opportunity as well.
Great, thank you.
I think Commissioner Hazen has her hand up.
Thank you. And I do want to just really underline, I think, what Myra shared first. I felt like you were inside my head and sharing exactly what I was thinking, and also what Jackie shared. And just want to add, Jackie, so I know you said, is what you're seeing in terms of access and barriers to transportation, is it just in specific communities or statewide? I can tell you that I'm working with national partners who are having lots of transportation related issues accessing, whether it's school meals or vaccines. So I do think that's an important thing for us to think about, and how we partner with delivery providers to get things to people, and not just thinking about sort of getting people to things. I am curious about the assessment. So the assessment said 53 of 57 counties responded, yes, there's a need for additional supplies. I'm curious, as we talk about equity, who are the counties that responded no, and are they larger counties? Because I think knowing who is important.
Benita, do you remember off the cuff?
If you give me 2 minutes, I can figure it out, but they were not larger counties. Mono was one, and they were all smaller. They were less than 5% of births, and one of them still put diapers and wipes as an urgent need. But I can get that information very quickly.
Yeah, I just think, as we're just deciding how and who receives support, thinking if folks are, counties are saying we don't really need it, then do they really need it? So I would put that out there. Also, in terms of the FEMA reimbursement, so it sounds like we're pretty confident that's going to happen. Is that accurate?
Much more confident than one of the original conversations we had with our female liaison, when we discovered and were surprised by the fact that these school systems, the childcare providers were not eligible. That it really was when entities were submitting applications to be reimbursed, all of a sudden the prior administration kind of shifted its focus solely to healthcare providers or people at hospitals, that sort of thing. And there was a considerable amount who were declined for reimbursement. Now with the new administration, he put out his memo clarifying, and I put that a link to that in the item, that, when it comes to childcare, when it comes to the school systems and others, they will now be eligible. And I actually had a conversation in late February with a liaison with Region 9 FEMA, who I described our scenario and why we wanted to get reimbursed and why we thought we were eligible. And he was hopeful, which made me hopeful, along with what was already in the memo and what will be provided in future guidelines that we're still waiting for. Because at that point, after I had that conversation, I was ready to submit an application to get reimbursed in the hopes that I could provide it to today's meeting and say, hey, we're approved. But we wanted to get something a little bit more clarity in writing to say, yes, this is 100%, and all we need to do is submit for reimbursement. So based on that memo, we feel pretty hopeful. Based on that conversation, he says this aligns with what, the priorities of FEMA are. So feeling quite good. There might be a few items that we distributed that might not be eligible, like books or I think it was baby formula, but that was a small portion of our costs. So feeling quite hopeful that we can get, anywhere from, maybe 50 to 80%. And, the 50 is very conservative as far as, what could happen. Now, you never know, but definitely much more hopeful than the first conversation we had with FEMA.
And one of the reasons I ask is, assuming, let's just say, 80% is reimbursed, do we want to think about a higher amount, recognizing the very limited impact on our bottom line, right? So I'm curious about that and anyone's appetite for potentially making a larger investment. And along those lines, I'm just trying to understand how do we land on 2 million?
I think the 2 million came based on kind of how, and you can clarify for me too, Benito. We've had rounds of distribution that cost X amount of dollars, right? And we figured with 2 rounds, it would be roughly $2 million to get those prioritized supplies out to every county statewide. So yes, it was an estimate, but we felt like it was a good one compared to, the 5 million and how long and how many rounds we were able to get with the 5 million.
It's hard to know without really knowing sort of what the need is. It's hard to say or to weigh in on what the right number is.
Sure.
And then just one last question, which is in the materials, it says, as it talks about, as Camille mentioned, the prioritization of childcare providers serving first-line responders and people working in essential services. So I'm wondering, is that what we did, or is that looking forward, who will prioritize? After that, it goes on to say, after those providers have been served, counties could provide supplies to the broader high-need at-risk community. And I don't know if that's right in that order.
Sure.
I'm thinking a lot about the broader high-need at-risk community and what those, if their needs are not met and those families don't have access to essential things like diapers and formula, do we need to be thinking about how we reach them and
sure.
getting supplies?
And so that was how we previously prioritized distributed supplies. And I will say, there was some local autonomy to kind of determine that, but we did prioritize childcare services for those essential workers and their children. However, I think there's a clean slate here where if there needs to be a certain direction that we go in or a shift in priority, we are obviously open to that. So any kind of suggestion or recommendation, what have you, we're all ears, definitely.
I believe Molly and Chris both had their hands up.
I was struck by our chairperson's reference to the Healthy Places metric.
Index.
Yeah, and that seems so right to me, because that's a place where the people don't have cars necessarily. These are places where you have a lot of immigrant communities who have undocumented status. They're not going to get any $1,400 check. It's, there's a real left behindness here in these areas. And I don't think they're short of children. I don't think they're particularly short of children. They may even have slightly more children than some of the other areas. So I don't see any reason why that wouldn't be our highest priority. What do you think about that, Simon? Do you think we could just say, what we want to do this round is we want to prioritize those neighborhoods?
Yeah.
Yeah, I mean,
By neighborhood, and do it by neighborhood, to all the good points that have been made to Jackie's point about there's communities, but there's neighborhoods. People are on foot. They're very beleaguered. I mean,
I think, so not wanting to speak for Simon, sorry, Simon, but the commission, we're looking to if that's the commission's, direction to us, certainly. I don't think we would disagree with that at all. And, so if that's what you all are saying to us, of course, we think.
Well, I think that's a great example of an indicator that we can use to help shift our focus. So again, as I mentioned before, I think with this new investment, we can shift priorities and work with our county partners. I don't want to speak for them. This might be potentially a shift for them depending on what county, but if it is a focus of this commission based on approval of this investment, then I would say it is what it is at that point. So I don't see, I was actually going to suggest before Dr. Burke-Harris mentioned the Healthy Places Index. Is there a best practice that we could possibly model? And it sounds like that might be one. I would also like to hear, is there an active best practice around partnering with delivery service or other corporations where we can get those supplies to people in a more equitable way? Because I think that's kind of the refresher that maybe is helpful and needed in the absence of very kind of micro level data where we can say, yes, it's going to that, these folks or this person or this organization. So,
I think there would be a lot of things that people would have to figure out.
Right.
And I think those are things that it would be excellent for them to figure out.
Right.
I think the counties, like so many others, all of us do this. We do the things that are easier. We do the things that are more familiar. We have default settings. And that is one of the reasons why we get these big disparities, because, people who are doing well are glued together and they have cars and they're in the network and everybody knows them. And I can't think of a better moment to make an effort to reach people that are harder to serve, that are not necessarily familiar to people, because this is at a time when a lot of people are moving out of the worst of this. And these are the people that are most likely to be stuck there longest. They've suffered the most. I mean, why, if we're going to do one more round here at the end, when things are improving for lots of people, why wouldn't we focus it on the people that are most impacted and most in need? If ever there was a time, it seems like this is it.
If I can just jump in with a quick comment, I know that Chris and Jackie are waiting to speak. Just in response to that, what I would say is that in looking at the data from CDPH, the essential outcome of the way that works, if there's a disproportionate share, and as you heard with vaccines, it's 40% going to the lowest quartile, which is actually very consistent with disease burden, because it's the lowest quartiles where we see 40% of, roughly 40% of COVID infection and death. The net result of that is that more wealthy counties have fewer Q1, so the first quartile API zip codes in those counties. And so there are some counties that will get fewer resources. Those tend to be, for example, the Bay Area counties, counties like Santa Clara County, et cetera. And then the counties that, and then some counties, and particularly what we see are rural counties, counties with high numbers of migrant workers would get an enriched supply. And I think particularly when we're talking about supplies related to protection from COVID, where we see the lowest HPI quartile experiences a greater burden of disease. And we also know that the highest HPI quartile has received a disproportionate share of vaccine already. So we see that 25% has received roughly 36% of vaccine. And what that means is that for the children in those communities, the disease risk begins to go down, right? Whereas the disease risk for the workers, right, for the folks who are caring for the children and for the children themselves is higher in our lowest HPI quartile. So from that sense, anyone who knows me knows that I'm extremely data driven, and I'll always bias towards using an evidence-based approach that's allocating resources in proportion to what we know is demonstrated risk or disease burden.
Thank you.
I think Chris and Jackie both have indicated they have something.
Thank you. You know, I was a little surprised by this special emergency meeting, given that we're meeting again in a few weeks. And I just wanted to suggest, as we work through some of these really important shifts in what's proposed today, that we remember that in just 3 weeks, we'll be together again. And we could revisit this topic and give staff time to do a very different analysis of what the commission is suggesting today around who would be the recipient of new supplies that we would fund, how would we get those supplies to them in a way that's cost effective and potentially builds on other partnerships in place already within the state, within the governor's office or OES. And then what other funding opportunities might emerge in that time? Will you know for sure from FEMA what will be permitted? While we're meeting there, you know, or just before we met, we saw that the House has signed the 1.9 trillion, and I'm sure in a few minutes or days we'll be seeing that start to move into states too. This is such a very dynamic moment in our state, in our country, and these dollars, granted, it may not seem like it's that many dollars, but if I think about the many things we've been asked to support over the years, and maybe we haven't been able to, $2 million is significant investment in a priority that we might choose to take action on. So I just, you know, this is just a process comment. It might be worth it, Commission, to ask staff to think about coming back in a couple weeks with a revised proposal that meets these these criteria that I think are will really move the commission to the forefront in how it's dedicating precious resources that are highly flexible. Unlike so many federal and state dollars, these are unrestricted funds in many ways. And so I just really encourage that the use of them is targeted in a way that gets to the children who have the least.
Thanks, Chris. I just wanted to address your question because I think it's a fair one. A couple reasons why we thought we would have this emergency, or why we wanted to, frankly, was to, as you know, putting contracts in place takes, a decent amount of time. We wanted to make sure that if there was an approval, we have certain things in place to where we can get a contract ready to go so that supplies could be distributed soon upon potential approval. And as Benito can attest as well, it takes time to procure some of these, and we felt like a few weeks was important in that timing of actually getting supplies out. And waiting till April, we just felt like it was a significant gap from the prior distribution that we had facilitated back in December. So that was just our rationale. Again, we just felt like even a few weeks was crucial.
But I guess that also struck me as odd when you were presenting that the contract expired in February, but you knew that for a long time, I think. And so it's kind of hard, right, when we find out after it's expired that it would be a good idea to revisit the agreement, revisit even the agreement with Supply Bank. That's also not a fait accompli, because this is a new day. That contract's done. So this brings up a lot of other important legacy questions and decisions as well about partnerships. And people have mentioned, companies that have been very generous on some of these issues. Supply Bank, I think new commissioners in particular might not be familiar with whether they're a nonprofit or a for-profit, and what their distribution channels are and what their sourcing channels are. Lots of questions like that might be really interesting to commissioners before choosing to partner again with this exact partner. So and in no way, this is not a criticism, it's just a process question. When a contract ends, and as you can see, the commission composition is changing, it's an important time to really look again at whether all those decisions from a previous commission are the right ones for this one. And if the timing is such that a contract expired and it wasn't brought to the commission before its expiration for an extension, this is a very different decision.
Yeah, in regards to the contract, we did not have the flexibility to extend it because we had done some time only extensions prior to that in order to maximize the amount that was approved. So on top of the fact that we wanted to reach out to our county partners to even see if there was a need or a desire. And so it all kind of culminated around this particular time. And again, just felt like, if the few weeks mattered before April, that, just to be frank, that was our rationale. So fair question.
Fair decision. I understand it. Yeah, thank you.
Jackie, do you want to go ahead with your question or comment?
Oh, sure. So of course, Chris had me rethinking some things. I will say this, I absolutely agree with process. I think it's a conversation for another time. I do understand we have a retreat somewhere in the books, because I always think we need to talk about process. I do not, however, think that whenever there's new board composition or commission composition that we have to, completely unbundle things that the prior commission has established, which brings me to my point that when the request for $4 million for extra supplies came up, we said no, we were not going to do that. We were only going to approve $1 million at that time. If my numbers serve and my memory serves me correctly, which my 6-year-old will tell me it never does, but we said, please go back because we don't know what in 4 months those needs will be. Well, that happened. They went back and determined what those needs would be. So I just want to remind us that that was sort of a charge that we gave whoever, to go back. We were not approving the $4 million at that time. I was one that quite frankly was like, I don't have enough space to store the stuff anymore, but I don't speak for entire California. And so we sent them back to do that. The timeliness of it all obviously puts us on a rush, but I do want to remind us that that's what we said. And so here we are, and we have at least some evidence and data that says families are still in need. And so this request is coming. I will say this, the equity lens has been our lens in everything for the last 2 years. It's something that we've been really lifting up, and one that I would support now, even in this, and ensuring that because there is a lot of philanthropic love being, showered on some of the agencies, and, some of the low-hanging fruit is being met in terms of getting the supplies to them, that if there was a way, I just can't think of it right now, but I would really like to say that we encourage the counties to ensure that it is going to those most in need, and not from a category, but really from those that they really understand that they haven't reached, they haven't gotten those zip codes. Those folks haven't shown up. Many of the R&Rs, we have lists of folks that are on foot, that are requiring bus tokens and things like that. So we can argue to say they probably didn't come and carry boxes of detergent and gloves and masks off, and they may be a targeted population. So I will just close in saying, yes, I think there's process things that I would love us to really talk about, because often I feel like on the meetings we are, staff is presenting something to us, and which we should be challenging and making sure we're understanding so we can really make good decisions about how we're spending money. But at the same time, I also believe we have to acknowledge and honor the work that the staff have done in preparing the recommendation for us. Camille, what I would also ask though is, what responsibility on First 5 California staff was there to let us know, hey, this contract is coming to an end. We want to engage them soon, because for most of us, we are hearing it for the first time, reading the email. And quite frankly, having limited time, I didn't even read it all the way through before I got on. So yes, but equity is really important to me. This is what we asked to be done. Not that any of us were expecting it to come back. But again, we didn't approve that $4 million at that time. We only approved $1 million with the goal that better research or more research be done on what communities really needed.
I had just a quick question because I noticed in your presentation, you mentioned that many of the counties said that they don't have any other source for these dollars. And that was just something I was curious about in terms of, so when we're talking about PPE and cleaning supplies and other things, none of that is being provided through CDSS or other departments?
Benito, you can jump in, but I wanted to clarify that is a good point that I tried to make and it depends, I think, who the recipient is. As I mentioned in my talking points, CDSS is providing PPE, and it's predominantly PPE as opposed to like disinfectants. And that was only for licensed Title 22 providers. It wasn't to a broader community or a wider range of recipients. So I guess when you think about who potentially the groups of folks that you want to target or who are most vulnerable in a given community, it could be limited because of other restrictions on other resources in that county.
I'm sorry, a point of correction. The dollars from CDSS as well as CDE were for all child care providers, license exempt providers. So they did not have to have a California license to receive those funds. It was stipend, AB AB 82, 89, I'm sorry, I'm all numbered out. But there were dollars as well as funding for the AP agencies and the R&R agencies to purchase PPE. So providers licensed and exempt, they could choose one or the other, but they were not for parents. And so I would say that's the other thing. Those were for providers, which a lot of the providers picked up things to actually take to their families, but it wasn't a direct connect. So there are a lot of other resources that are coming. It's certainly not enough, but I just wanted to clarify that.
Yeah, thank you, Commissioner Majors. That was, I tried to do some of my homework, and I had actually reached out to CDSS staff to clarify, and maybe they had multiple opportunities, and this was just one specific program. They did, however, say exactly what you said, which was they had surveyed their constituencies, and the number that they asked for was not available. So obviously, it didn't reach the entire population or the amount of actual items that they requested. So yes, thank you for clarifying.
I believe the question was asked in the survey we sent out to our counties is if they had access to other resources besides this, wasn't it? Wasn't that one of the questions, if I recall?
Correct.
So that's where the information we gathered from them came from.
So if I may interject, I wasn't sure if I'm supposed to raise my hand or the PUC, we always use WebEx. That's the only board I'm a part of. But I just wanted to add, well, quickly for Commissioner Pazan from a while ago, it was Mono, Nevada, Tehama, and Tuolumne counties that replied no, but 2 of them still marked some items as high need or urgent. So there may have been confusion. In respect to Commissioner Perry's question about us, we are actually a nonprofit. It's very clear in our contract, 3.75% of what we do is for everything that's not cost of goods, which are reimbursed after we deliver them. But to the much more important question on equity and distribution channels, so I think with the Commission's responses to the survey, they were looking at populations beyond child care providers. As Commissioner Majors pointed out, at the beginning, there was confusion about what PPE was being delivered for what type of child care provider. I remember that was part of talking points, an event we did in Humboldt months and months ago, shortly after the pandemic started. But since then, I know that a lot of commissions have really prioritized the broader community and used a lot of the different distribution channels that you're talking about. So for example, for migrant farm workers, we also work with an organization called La Cooperativa Campesina, which works with the campesinos through 5 member agencies through all the state. The same agencies that we work with for that partnership are also working with a lot of the First Fives in the Central Valley. So for example, in Kings County, the Kings County Community Service Action Agency, which does a lot of outreach and work with farm workers as well as many other programs, also works with Kings County First Five for this program. And so they're combining resources. And that network in itself has thousands of points throughout the state. My point behind all of this is that certainly with added data, and I confess I haven't seen the CDPH data, and from an academic standpoint, I'm very interested to read it. Those distribution channels exist, and the First Five commissions are the ones who understand where they are at today and how they can be worked with. So just as at the beginning of the program, where we were initially really focusing on childcare providers and then the broader community, which was followed by a shift, as Commissioner Majors pointed out at the subsequent meeting, to look more towards the broader community, because at that point, First Five wasn't the only partner working. CDSS and CDE had caught up and started programs of their own. That could be a pretty easy shift for a future iteration of the program that would be relatively seamless, simply because the county commissions already understand where these organizations are that can actually reach the neighborhoods that have been talked about here. That's why First Five county commissions are such great partners in many other programs that we do.
You know, if I might, Madam Chair. Yeah.
Please.
That to me, that resolves the one thing that would be a snag. Rather than postpone this decision to the next meeting, once we know that between Benito and the counties, they could implement a directive that said you will deliver these things to these zip codes that are identified in the healthy places metric as a priority. Once we know that that's implementable, which is what I hear Benito saying, then I don't see any reason not to just go ahead and do that and say, you know, let's get after it, because it probably will take them, you know, it is a change, but I'm delighted to hear that they're as good as they already are at that. They aren't going to be completely reinventing the wheel. I think we should hear from Camille on this and hear what she's very close to the county. She knows their capacities from long experience, but it sounds like there's a possibility that we could just say, this is, you know, we're willing to do it if it's prioritized in this way, because it sounds like it's implementable. So maybe just Camille, can you tell us something about that?
Yes, I do think in many ways, as has been described, they're already doing that. Those networks are established, you know, in many of the counties across the state. I think our county partners understand the priorities that our commission has placed on really reaching hard to reach populations, and understand that, and would be willing to work with us to make sure that happens.
So then what we would do is we would, instead of allocating the money by birth rate, we would allocate it by the number of children in each county that live in the zip codes that are meeting the bottom quintile metric. And that will affect how much money, say, Marin County gets. But there are poor children everywhere, and Marin County will take the money that it gets and give it to whatever neighborhoods there are in that county that meet the need and meet the criteria. I think it's very logical. Sounds like it's doable.
Molly, can I ask a question to your recommendation? Because I agree. I agree with not holding it up, because this took quite some time the first time to actually get supplies into people's hands. And so if that's contract timing or whatever, coordination timing, I agree. But the question I would ask is, when we put this equity requirement, because that's what we're saying, and maybe I'll ask you, Camille, is that what you're saying? Because I don't want to give an equity suggestion. I want to give an equity requirement. But then how do we help counties do that? So if we say you have to get it to these neighborhoods, but their local first five is not in that neighborhood, and they're getting supplies and not dollars, is there a way, and I don't know if it's a good suggestion or not, but how do we provide them, or how do they fund that? How do they fund the U-Haul truck, or, you know, whatever else they need to do to get those supplies out? And is that something that we could incentivize or help with in that request? And you guys, excuse me, the chat function is not on. I thought you would choose not to watch me eat, which is the only reason my camera's not on, but I'm here.
I think Benito may have some thought about that. Let's ask Benito.
So an example I would point to is Santa Clara County. We actually delivered to, I don't know, 2 to 3 dozen family resource center and different type of sites. So I think pragmatically, the way we would try to structure it is to look at the zip codes and the neighborhoods that we're talking about, work with the local commission to understand which CBOs, if they don't have a direct presence there, that they trust to work with to achieve that objective. And that's something that's pretty regular and simple for us to do because it fits perfectly with our model. It's really still the same principle of going to the local commission and leveraging their institutional knowledge as the authorities on this within their respective county, and asking them for guidance on which community-based organizations and other agencies to trust to achieve something. And so this is in lockstep with what's worked very well before and is still working well in counties that have ongoing programs.
Are you telling us, Benito, in answer to Jackie's observation about cost, that the community-based organizations will see it as a leverage opportunity? These things are free to us if we bring the trucks. And so we'll provide the trucks because this is a great thing for us. Is that what you're saying?
Yeah, everything from putting the pallets on the loading dock, bringing it down to the curb, and wheeling it into the actual facility can be part of the service, as well as all the coordination that happens beforehand. That's exactly what the supply bank model and vision is really just centralizing coordination and procurement as competitively as possible, and then working with community-based organizations across the state to make sure that the delivery is as convenient and as helpful as possible so that they can just serve the clients they need. And you're absolutely right. All of the research, focus groups, et cetera, we've done shows that it strengthens their relationships with their respective communities when they do that, because whether it's in this case PPE and emergency supplies, or the 20 counties we've worked with, First Five in the past on the Talk Read Sing Diaper Kit program, all the feedback is that it strengthens the relationships of the service providers when they can provide something to their communities that their members need and sadly would otherwise go without.
Thank you.
If I may, I'd like to make a friendly amendment to Molly's, I think what's crafting as a motion. As much as I value advancing equity and using the vaccine equity metric, I will tell you there are some counties who do not have census tracts in that first quartile, specifically Santa Cruz County. Did not make it on the list in terms of being having a jurisdiction in quartile 1, and being a neighbor of theirs, I do know that they have communities that are lower income. And so without pigeonholing ourselves to using that specific equity metric, I would like to suggest that, you know, first state staff work with local First Five commissions to ensure that whatever allotment of the supplies or the resource that is on the table today for us to approve be prioritized in their communities of greatest need, whether that be, you know, based on disease burden, whether that be based on a mix of other factors that are preventing those families from being able to access services or have supplies needed to protect themselves. So I just wanted to make sure that we understood that not every county has a census zip code or zip code that's in this current revised equity metric.
So can I just clarify really quickly, because I don't know that Molly was proposing that all of the vaccine go to the lowest HPA quartile. Certainly that's not what the state proposed in terms of our vaccine equity metric, but rather what the state did was gave 20%, gave 40% to the quartile that had 40% of disease, and then the other 60% was divided equally among the other quartiles. So 20% went to the first quartile, 20% went to the, 20% went to the fourth quartile, the highest quartile, 20% to the second highest quartile, Q3, and then 20% went to the third highest quartile. And so I want to make sure that there's not an impression that when we're talking about an equity metric, we're talking about equity meaning that those in the higher quartiles get nothing, because that's not the case. What we're talking about is when we look at the proportion that's given, and I would even argue further, what I would argue for is that it actually is distributed along the lines of disease burden, where it turns out that even 20% in the highest socioeconomic quartile is actually an oversupply because they only have about 10% of disease burden, right? So it ends up working out to about 40, 30, 20, 10, which is what would truly be, in my mind, if we're thinking about equity allocating resources in terms of risk, that would be what I would propose.
Wonderful. I love that. It's a wonderful refinement, and I really appreciate it. And it solves Elsa's problem of there being a county that doesn't get anything, which is hard on the networks it's hard on the fabric building that we do. Having a county get absolutely nothing is an issue. So I like what you said. It really does solve a major problem.
Commissioner Perry, did you have an additional question?
Again, just a process question. It seems that if consensus is emerging around a different motion statement, which it sounds like, there are key points that folks have agreed to, it might be an interesting point to try and share a different way of a different motion statement that you could all talk about, because the way it was originally presented isn't going to fit the way the conversation unfolded. So I know Molly is a pro at this and others, but while the conversation's unfolding, it might be helpful for the staff or someone to think about how you might rephrase that motion statement for action, to touch on the equity measures that.
So I will take a stab. I will say I would move to approve up to $2 million from the unallocated account through summer of 2021 to continue to provide local communities with their necessary supplies to combat COVID-19 in proportion, using an equity allocation that is in proportion to disease burden, utilizing the Healthy Places Index. So disease burden by quartile, utilizing the Healthy Places Index.
Second.
Do you want to call for public comment? You're on mute. I'm sorry.
Oh, yes. So I want to check, is there any, I know that the next thing is public comment, but I just wanted to check in among commissioners if there's any other comments, questions based on the way that motion is framed.
Everybody can. Yeah.
The only comment or even question is, can we just make sure that we get that breakdown of providers versus families, or childcare providers versus other providers, and the families that are receiving the services, whether it's baby wipes, diapers, things like that?
So amended. So should we amend the motion to include that the commissioners will receive that breakdown? Okay. Is there any public comment? Looks like there's a couple of hands up.
Yes, Alethea?
Hello, good afternoon, Chair Dr. Nadine Burke-Harris and Commissioners. This is Alethea Argulas from First 5 San Diego. I'm the Executive Director here, and I simply want to, thank you for your ongoing commitment. What an amazing discussion you just engaged in. Definitely appreciate all of the various considerations, and I want to just express our tremendous gratitude from our communities here in San Diego County. As the second largest, we were able to activate with our local coalition groups that really brought together community stakeholders to really ensure that we were distributing these resources to our providers that were still operating, that had the most need. And I can assure you that the entire conversation around equity definitely resonates for myself and my colleagues here in the county. We also utilize this as an opportunity to leverage additional funding from our County Board of Supervisors to the tune of over $25 million to help our providers through the Federal CARES Act dollars, and also a small portion from our local first $5 and some philanthropic investments. So it has been really amazing and truly heartfelt. We appreciate the continued commitment. Working with our local distribution hubs that were lifted up as a result of this is really the manner by which that we look forward to continuing to reach our communities. We have over 4,300 licensed family child care providers in San Diego County, and we want to continue to support them because this is the opportunity for us to serve them. So on behalf of San Diego County's coalition, we just thank you for your commitment and support.
Thank you for that comment.
Okay, next is Juanita Morales. We have.
She's muted. She has to unmute. Can we ask Ms. Morales that you unmute yourself?
Thank you. Good afternoon, First Five Commission, commissioners, staff, and members of the public. My name is Juanita Morales. I'm a program manager at First Five Solano. And first of all, I just want to thank the commission for the continued support of families in our community. And so when the pandemic hit about a year ago, the emergency supply program provided the much needed support to childcare providers, nonprofits, children, and families in Solano County through the emergency supplies, including PPE and other essential items like diapers and wipes. And so we know that even though the virus is improving, it's still here and even more prevalent than it was when the emergency supply program began. So the need still exists and remains urgent in not only Solano County, but in many other counties throughout the state. And as Simon mentioned, in the beginning, the scarcity of supplies was a main concern, and the cost for childcare providers and those that have been most negatively economically impacted by COVID is now equally challenging and continues to remain a serious issue. So the investments by First Five California and local leadership in programs like this not only provide those critical supplies to childcare providers and other partners, but also strengthen the local commission's relationship for ongoing COVID response and future programs. Some of the supplies that were provided to Solano County through this program were nearly 190,000 disinfecting products, including hand sanitizers and soap, about 75,000 masks, 45,000 gloves, 72,000 diapers, close to 12,000 baby wipes, over 700 books, and 120 infrared thermometers. Now, that's quite a bit of supplies for our community that not only didn't have access to these supplies, but couldn't afford it. So on behalf of First Five Solano, we fully support this much needed investment to make sure our childcare providers, our families and children get what they need to help reduce the spread of the virus. So again, thank you for your leadership and continued support for this program.
Next
Thank
is
you.
last name of Graham, M. Graham.
Are you able to hear me now?
Yeah.
Great, thank you. My name is Michelle Graham. I'm the CEO with Children's Resource and Referral in Santa Barbara County. On behalf of Santa Barbara County, we are in full support of this much needed investment for our children and families. The virus is still present. The need for supplies exists. There is urgency to get these items out into our community. The cost and access continues to be issues for our community. The program has been wonderful. We have had hundreds of thousands of items delivered through the PPE, and these have been essential to keeping our families and children healthy.
I want to thank First Five California, this commission, for your leadership on this work. In regards to the equity question and priority, I would ask that you would consider allowing the counties to make the decisions of those, identifying those in the highest need. Both First Five Santa Barbara as well as us, Resource and Referral, we do know who those high need communities are. And if given the opportunity, we would be able to identify them quickly and get those resources to them as soon as possible. Thank you for your time.
Next is Mary Ann Hansen.
Good afternoon, Chair Burke-Harris and commissioners. Thank you so much for being here. I have so appreciated your conversation about equity this afternoon and want to commend you for just your thoughtful approach to this. I should have introduced myself, Mary Ann Hansen from First Five Humboldt. And First Five California's investments in emergency supplies have allowed Humboldt County to serve our most vulnerable childcare providers, helping them to stay open and provide care to working families, especially the family childcare providers who are traditionally less connected with supports. And we've been tremendously grateful to our local resource and referral agency, Changing Tides Family Services, for helping us make this possible and for delivering supplies directly to those providers so that they weren't experiencing some of the barriers that can come up. We've been surveying family resource centers and other family serving programs throughout the pandemic regarding their needs. And we recently partnered with our local transitional housing programs that are serving families with children 0 to 5 who are experiencing houselessness. These programs have recently experienced COVID outbreaks, and additional materials support from First Five California would allow us to pair your resources with First Five Humboldt investments so that we could provide additional safety supplies and diapers directly to these very vulnerable families. So I just want to commend the commission for their consideration of this additional investment and the potential for allowing us to continue this partnership. And I want to thank you for your leadership and your careful consideration of the needs of our youngest children and families. Thank you so much.
Thank you, Mary Ann.
Okay, next is Lonnie Schiff Ross.
So first, apologies. I was a little too excited at the beginning with my public comments out of order. So again, apologies for that. I am Lonnie Schiff Ross with First Five San Joaquin. I did just want to mention as the issue, and thank you, Chair Dr. Burke-Harris and others for bringing up HPI or Healthy Places Index, is First Fives have, even before Healthy Places Index was being discussed, issues of equity has always been a top issue and a priority issue for First Fives. Locally, as I look back at where some of the distribution went, they went to WICs, they went to family shelters, they went to community centers, dining halls, all areas that are high poverty. And we know poverty and HPI go hand in hand. So again, I appreciate the focus there. I feel confident that First Fives know their communities, know those little niches that while some may not show up on HPI, First Fives have that pulse in the community to know where to meet the highest needs. So thank you again for your ongoing support.
Thank you, Bonnie.
Mario Gonzalez.
Good afternoon. Mario Gonzalez, Deputy Director with Centro La Familia Advocacy Services. We serve the communities of Fresno County. On behalf of Fresno County and our rural communities, people of color, and our immigrant communities, we want to thank you for taking this opportunity to ensure that our families are being served. We serve as a hub for Fresno County First Five to distribute to the community, to the rural communities within Fresno County, reaching up to 13, 14 different rural communities to ensure that they have access to these resources that they otherwise would not have access to because of the low wages, of the insecurities and lack of transportation, lack of access to different items that these funds are allowing. So we thank you for that because it allows us to serve as that connector to take these items to those families in need, to ensure that they have them, to ensure that they're keeping safe and staying healthy. We know that there was a rise in our farm worker community with the COVID infection. And because of these items that we received, we were able to ensure that these families had access to them and take them out to the communities that were most impacted. Through our work with Fresno County First Five, we have identified the communities that are most in need, the communities that really have a calling, have a lack of access for these items. And with these additional funds, we would be able to serve and provide these additional masks, hand sanitizer, and all these other items to them. We have families who don't have that ability to purchase them. We know that for a fact. And so with this, we know that they're going to benefit because we will be able to personally hand them to them. So once again, thank you for taking the time to listen to us, taking the time to ensure that our families have a voice and ensure that everyone around us is being heard. So once again, thank you. And thank you for hopefully voting in favor of this to ensure that our families get what they need.
Mario, thank you for taking the time to speak with us today.
Next is Carrie Venegas.
Apologies and good afternoon. A little technical difficulty there. Thank you so much. I want to thank the entire commission and Chairperson Dr. Burke-Harris. Thank you so much for considering this and for the discussion that you had, particularly around equity. I'm the Executive Director of Changing Tides Family Services up here in Humboldt County, and we are the local R&R, so the Resource and Referral Agency, as well as the AP Child Care Subsidies Agency. And I think one of the things I want to note is that when the pandemic first hit, my staff and I were the ones out in Costco buying a box of diapers at a time. And although the state moved to take action, really the action that this commission took to put things in the hands of us as a distribution center for childcare providers was so incredibly important because it limited the risk also to our own staff so that we could focus on directly delivering those supplies. And as I'm always fond of saying, the partnerships are so strong up here, but this has made such a bigger difference. We are even stronger by partnering. We know our communities and we're able to reach the areas that even with the zip code analysis may not show up, the tribal members who live within our city limits versus out on the reservations, our tribal childcare programs who are also eligible for state supplies, but may not realize that because so many things get isolated and islanded in a process that's only exacerbated during an emergency and a pandemic. So this has made a huge difference between doing 6 inches of good and support out there to doing a yard. When you have multiple streams come in and you have good partners who coordinate, you're able to not replicate, overlap, or duplicate, but spread the net so much wider in making sure that all of our families are supported. And I also want to thank you for having the flexibility at the local level so that the families we know who may not be able to access childcare right now for a variety of reasons have also been able to benefit from these supplies. That has been incredibly important to all of our families up here. So thank you again for this discussion and the consideration. And I really just want to say that our local First Five up here, you heard from Mary Ann Hansen, the executive director earlier, that partnership has been amazing. And we are so grateful for all that you've done.
Thank you, Carrie.
Next is Carla Keener.
Good afternoon, Chairman Burke-Harris and the commissioners. Thank you so much for this time and this opportunity to speak with you. My name again is Carla Keener, the Director of Programs for Alameda County. And so many of my colleagues have already talked about the impact of this funding that you all have generously provided and the impact it's made in our communities. And I just want to say from Alameda County's perspective that we have appreciated the partnership with Supply Bank. As early as April, we had meetings to redeploy resources to get to the 4 neighborhoods ready for school communities that we have funded since 2017 that are located in the neighborhoods with the greatest disparities, both economically and from health status. So we were in partnership with these communities, and Supply Bank was able to help us quickly pivot to make sure that we got supplies, diapers, masks, gloves, sanitizer, cleaning solutions, not just to the childcare providers who were working with essential workers, but to family childcare, family friend and neighbor, and to the families in those communities who couldn't take the very few dollars they had to buy these supplies, even if they could find them. So we appreciate that partnership. We also want to appreciate that the partnerships have been able to be deepened, and we've been able to get data that we can share once we talk with Benito about who's getting the supplies and what impact it's made on the life of the child, the life of the providers, and the life of the community. So we want to also appreciate the equity conversation because we have used a similar index in using our Community Resiliency Fund that we've spent over $6 million to redirect Prop 10 funding to support our communities, as well as leveraging SSA CARES funding through, again, work with Supply Bank, where we were able to get those air purifiers and other supplies that Benito talked about. And over the weekend, had more than 500 family childcare providers come to the Oakland Coliseum to pick up 2 purifiers and filters for a year. So not just for the COVID issue, but for the wildfires and other health hazards that we know are sometimes in the homes where we are caring for children. So we thank you so much for the contributions. We thank you for what we've been able to do in our county. And we thank you for the ongoing support as you consider this motion. So thank you very much for the time.
Carla, thank you so much for your excellent work.
Next is Ophelia Gonzalez.
Hello. Sure everybody can hear me. Hi, everybody. My name is Ophelia Gonzalez. I'm Public Relations Director with Central Valley Children's Services Network. We are Fresno County's local child care resource and referral organization. First and foremost, I just want to thank you for everything that you have provided with your help in the ongoing partnership of our local First 5 Fresno, First 5 California. I just want to say I've been with Central Valley Children's Services Network for 18 years. And through those 18 years, First 5 has been one of our most loyal and one of our strongest partners. We've consistently and constantly worked on different ways to better serve the needs of the families and childcare providers and the underserved communities in Fresno County all around. And so with the emergency supplies that were distributed, we were able to help over 300 family childcare providers, 20 childcare centers in need. So I do want to specify that those are providers that were in need, and of course, license exempt providers, which we have so many, especially in the rural communities. And we call those, we call those family, friends, and neighbors. So as we know, childcare providers is a population that funding wise is already undercompensated, and the adversities that childcare providers face have only grown with this pandemic. Initially, when we think of the supply and the demand along with the childcare hours, many of the childcare providers would share that it was just impossible for them to even go out to the stores and get the supplies. And by the time that they would go, even for any of us who hold a normal job, there were no more supplies left. And still, with that and struggling just to keep their doors open, the regulations are still in place requiring them to constantly be cleaning all of the areas after each child. And so, of course, making the situation even more costly. So that's something that hasn't changed, even though many may say the pandemic's getting better, but that is something that they're still struggling with. They're still struggling with, and it's still costly for them. A specific childcare provider, because we do reach out to them and we speak to them, that comes to my mind that I spoke with was a provider in a rural community in Fresno. And I remember just crying. She was crying over the phone, because she was on the verge of closing her family home daycare. She was on the verge. Her husband was unemployed and she had a handful of children in her care. But she said that she loved the babies in her care so much that she couldn't find it in her heart to shut down, because she knew that if she were to shut down, that those babies were going to be left without care. And this is, the parents of these children are farm labor workers. And so this is just one of so many stories that speak to the hardships and to the difficult decisions that childcare providers are faced with. And so any help, any support that we can give them, we know it's going to create a positive effect. It's going to benefit not only them to keep their doors open, but it's going to help the families and it's going to help the babies, the children in their care. So CSN, Children's Services Network, 100% in favor of an investment to help.
Thank you, Ophelia.
Thank you.
Dr. Burke-Harris, I believe we have
one more,
but we also have commissioners who are time certain to get off at 2. So just so you know.
Okay, Fabiola Gonzalez.
I'm going to make my statement short because my colleagues have spoken. My name is Fabiola Gonzalez, and I'm the Executive Director for First 5 Fresno County. And I was so excited that some of our partners were able to join to express their support for the investment that's before you. And I just want to point out that I believe, First 5 California dedicated to making sure that every child in California gets the best start in life. That's the vision that you show on your website. That's how we, all the First 5 commissions that partner with you, that's what brings us together. And I want to remind you that your original investment helped mitigate the impact of the pandemic on our youngest children, especially in the most vulnerable communities in the state. As you heard, in Fresno County, we partner with a lot of these CBOs and a lot of the childcare providers that remained open, especially in our rural communities where it's an hour away from the city of Fresno. So many of these folks can't go to the big stores. In California, we come together to prioritize the well-being of our youngest residents. And I think what the conversation that you had today, your leadership to do this more equitably to support our most vulnerable children through these difficult times is most welcomed. I just saw the HPI index for Fresno County, and most of our cities, most of our communities are in the dark blue area. So I welcome the opportunity for this new investment to be very specifically focused so that we can continue to just focus the resources on the families and the providers that need it the most. Thank you so much for the time.
Thank you so much, Fabiola. And now we'll go ahead and have Jamie call a roll call.
Dr. Burke-Harris, do you want us to read the motion one more time? Because
please,
we want to make sure we have it right, because there was a lot of words at the end. So, okay, so the motion is we move to approve up to $2 million from the unallocated account through summer 2021 to continue to provide local communities with necessary supplies to combat the outbreak of COVID-19 using an equity allocation in proportion to disease burden in counties by quartile utilizing the Healthy Places Index. Staff will provide families data around families and providers who are receiving the supplies through the program. So we know that we could have left some words out. That's why we're asking.
That sounds right. No, it sounds like you got it right.
Okay.
Yes.
I have a point of clarification, because one of the things we were talking about was we were talking about the fact that some counties, and maybe Fresno is a good example, where a lot of the zip codes are going to meet the high need, and there's a lot of kids. And then there's other counties where there's a lot of kids, but they're not going to have as many, they're not going to have so many zip codes that are, or so many children in the zip codes that are going to be so highly at risk. And I think what we are intending to do is to leave no county with no coverage, but to allocate the money so that more money goes to the places where there are more children that live in these zip codes. And I just want to be sure, I just want to see whether that's where we are.
That's accurate. So that's what's intended in the term of in proportion. And so, for example, if you have a community like, if you have a community where all of the children are in the highest quartile, right? We recognize that the highest quartile only has 10% of disease burden. And so when you weight the amount of dollars that would go, or the amount of resources or support that would go to that community, it would be weighted. For example, you might take some baseline number and multiply it by 1, right? Whereas with those with, if they have 10%, and if the community that has 40%, instead of taking that number and multiplying by 1, you would take that number and multiply by 4, right? And then, so that way the proportion, every community would get something, but those who have the highest proportion of disease would get a commensurate proportion of resources.
Yes, and when you looked at the state as a whole, that would be applied to the state and the children in it as a whole.
That's right. It would be applied to the state as a whole. That's right.
Yeah. Okay. Thank you. I'd just like to say one other thing. I appreciated, and I don't want to suggest that the counties haven't been doing a good job with equity and reaching underserved. I'm sure they are. I think this is a wonderful opportunity to use a current, sophisticated, statewide metric. Everybody can use it. What they're going to find out, as they already have, is that it's going to overlap a lot with what they're doing. And that's one reason why it's implementable. But it's implementable, but just using this one metric for everybody makes it much more predictable and really fair and transparent. So I think we've, really together have accomplished something. I'm sorry, that's enough.
Commissioner Hazen, did you have anything? I saw you raised your hand.
I was just gonna really agree with the intent that both Molly and Nadine shared. I'm wondering if that can be added or should be added to the motion, just to, because I think that matters. I don't know if anyone would accept that amendment, or if it's clear enough as it is. I guess maybe the question is for staff, is it clear enough as it is, that is the intent reflected in the motion as it exists?
I think as it was clarified by Dr. Burke-Harris about what in proportion meant, if the commission is, we understand what that means, and if the commission is good with it. Yes.
Perfect. Thank you.
There's, yeah. Would you like us to call the roll, Dr.
Let's go ahead and do that, because I see we're over time, and I know that commissioners need to move on to other meetings.
Okay, Myra Alvarez.
Aye.
Elsa Jimenez.
Aye.
Monica Fitzgerald.
Aye.
Shana Hazen.
Aye.
Jackie Majors.
Aye.
Molly Munger.
Aye.
Dr. Burke-Harris.
Aye. So the motion is carried. And now we'll make a motion to adjourn.
So moved.
Second.
Do we need to do a roll call, or can we say all in favor?
We can say. Yes, all in favor works.
Great.
Thank you, commissioners.
Adjourned.
Thank you very much.
Thank you very much.
Thank you, team, for your hard work. Thank you, commissioners. Take care.
Take care.